Because good communication is part of good healthcare.
Because patients have a right to make choices about their health care.
Because I don't want my family to have to guess what type of care I want if I were to become very sick.
Because I care about my health care.
Hello. Presbyterian is proud to serve the residents of our beautiful and diverse state. And I'd like to let you know that your healthcare team is committed to providing care that is respectful of your wishes and individual values. You can help by creating a plan to protect your healthcare choices. We know that when there's a plan for healthcare, the patient and family experience can be better because there is no guessing. Everyone knows exactly what you want and who should do what. You can start the process by thinking about two important areas. First, who will serve as your representative if there were to be a time that you couldn't share your wishes with others? This person is called a healthcare decision maker and is sometimes referred to as a medical POA or agent. Choosing a healthcare decision maker who knows your values and wishes is a key part of an effective plan. Second, think about what type of healthcare you would want if you were to become very sick. As you think about this, consider, what is your definition of quality of life? Are there concerns you have about potential medical treatment, such as not getting enough treatment or getting too much treatment? Your healthcare team can answer questions that you might have as you think about your plan. Next, talk with your family and loved ones. Remember that sharing your healthcare wishes doesn't have to be an overwhelming conversation. It can be several small conversations. Let them know that sharing this information is important to you because you never want them to have to guess about what type of healthcare you might want. The important message is that by sharing your healthcare wishes, you and your loved ones can have peace of mind in knowing that there's a plan. Because memories of conversations can differ, the last step is to document your wishes by completing an advance directive. There are many different styles of advance directives, and there is no required form in New Mexico. At Presbyterian, we made the process easier by offering an electronic advance directive option. This easy-to-use process will guide you through each step and offer helpful information along the way. You can access this site at phs.vincahealth.com. Once you have completed your advance directive, be sure to sign and date it. In New Mexico, you don't need a notary or witness, and you don't need an attorney to complete the document. It is also important to give a copy to your healthcare providers and your healthcare decision makers. If you completed your advance directive by using the Presbyterian electronic system, a copy will automatically be available in your Presbyterian healthcare record. Your plan to protect your healthcare wishes may change. Advance directive documents should change and grow with you. It's a good idea to review your plan periodically to make sure it still represents your wishes. Because I want you to be at the center of your healthcare, I recommend an advance directive as a routine part of healthcare for all adults.
I
I have an advance directive.